Attention. Welcome to the Different Spectrums podcast. We dive into the wild world of mental health discussions. Get ready for profound talks, a sprinkle of humor and sarcasm, and a touch of colorful language. Just a quick heads up, our show reflects our individual opinions, which may not align with the standpoint of the podcast, our featured guests, or any related corporate entities. Our mission? To illuminate through laughter and satire because everyone needs a good chuckle. Chill out and don't stress over the small stuff. Legal troubles? No, thank you. Cancel culture? Please spare us. We'd rather keep this space lawsuit free. So buckle up, have a good time, and join us as we navigate the vibrant realm of mental health on the Different Spectrums podcast.
Hey everyone, so just as a heads up, we were switching some software around. I made some mistakes. So everyone's audio is going to be good, but mine in this episode. So just to let you know, that'll be the only episode where you'll see that mistake in. And also, the camera angles will be different. You won't be able to see all of us at once. So just want to give you all a heads up before we get into the podcast. Fantastic guests that we have on today. Enjoy the show. Again, my apologies. Next week's we'll be back to normal. Peace.
Hey everybody, we back again.
Hey, we're back and we're live.
I'm Spencer, your co-host, and that's our licensed clinical therapist, Naz.
Freshly showered, freshly shaved, Dr. Nas.
Remember, don't take us too seriously.
Or do. That's completely up to you.
There you go. Also, don't forget to wrap those likes for us. We'd really appreciate it. So, we have a special guest today. Our guest blends deep clinical expertise with athletic experience and performance culture. She's a board-certified sports medicine and family medicine physician who works with athletes and active individuals. She also serves as a team physician for U.S. figure skating. A former powerlifting champion, and also she does Brazilian jiu-jitsu. She is also co-authored Bodybuilding Anatomy. Please welcome Dr. Christle Guevarra. Yay.
Hi. Hey guys.
Why is it every time we have guests, I'm just like, I ain't did shit with my life.
Oh, really padded your resume there.
Girl, you think you got some achievements? I think you got some achievements.
Yeah.
Just a few. Just
Just a couple.
doing stuff. Just doing stuff. Yeah.
See what happens. Yeah.
Did you also do a fellowship at the University of Nevada, or
Yeah, that's where I did my sports medicine fellowship.
with D1 football players? That's pretty cool. Pretty cool. We'll get into it.
Yeah.
But yeah, nice to have you on, Christle.
Thanks for having me. Yeah.
All right. So today we are covering the movie Pulp Fiction, Tarantino classic. Features plenty of stars like Bruce Willis, Samuel L. Jackson, Uma Thurman, all the greats in the film industries. And we're just gonna be covering one scene, mainly around silence. But we're going to relate it back. We're going to talk about GLP-1s. We're going to talk about food noise, and also how we are able to find room in our daily life since we don't have that food noise anymore, and focus on the rest of our daily lives. Gonna be some great topics. Naz, anything before we get to the show?
Extremely excited, man. As some of you may or may not know, I've been on this GLP-1, and it's been a hell of a journey. You know, I took the one, it damn near killed me.
Yeah.
And I felt horrible, and I was one of them 15% that have horrible side effects, and I stopped it. And then I got in the next one that my brother got on, and then, I lost some weight. Wasn't as bad side effects, went up. Shit was terrible when I went up, and now I'm at 10. Now I'm losing weight again.
Yeah.
And it's like, feels fantastic. It feels fantastic. So I can't wait to talk about it.
Yeah.
It is so much this and that, right? I told one of the clients yesterday, you better be careful. I said, what you talking about? She said, there ain't got enough studies on that stuff. You don't know what it'll cause. I said, girl, I was about to die from being fat. I'm about to have a heart attack. What are you talking like? I'm going to die now, die later. Obviously, I'm being dramatic, but so there's a lot of noise out there just in general when what you said noise. So I seen that what you were doing on your Instagram, I was like, we got to talk about this. We got to talk about it because it's a hot thing right now. The pills are now out from both companies. Eli Lilly got another pill or another shot coming out called the 3G next year, right? That's supposed to have 30% weight loss, all this other stuff.
Yeah.
So excited to talk about this and some science and educate some of our clients.
Yeah.
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 Let's do the pod. Whoop, whoop.
Heck
Whoop,
yeah.
whoop.
You got to say whoop, whoop.
Whoop whoop.
There it is.
Martin and Lewis. Vanilla Coke.
Yummy.
You think I can have a sip of that?
Be my guest.
I gotta know what a $5 shake tastes like.
You can use my straw. I don't have cooties.
Yeah, but maybe I do.
Cooties I can handle.
All right. God damn, it's a pretty fucking good milkshake.
Told you.
I don't know if it was worth $5, but it was pretty fucking good.
Don't you hate that?
Hey, what?
Uncomfortable silences. Why do we feel it's necessary to yak about bullshit in order to be comfortable?
I don't know. That's a good question.
That's when you know you found somebody really special. And you can just shut the fuck up for a minute, comfortably share silence.
Well, I don't think we're quite there yet, but don't feel bad. We just met each other.
I'll tell you what. I'm gonna go to the bathroom and powder my nose. You sit here and think of something to say.
I'll do that.
Hey everyone, have you been looking for something to help you when you feel extra fidgety? How about when you have a sensory overload? Well, I'm here to introduce you to the Oh No Fidget Roller. It helps me regulate and also feel at ease. The Oh No Roller comes in 5 different materials, including plastic, aluminum, steel, titanium, and silicone. You can use our code DSP10 to get 10% off your order when you visit onoroller.com and get your roll on. And we're back again.
Hey, we're back and we're live. This is live with my big ass losing 30 pounds. I know, good 30. Lost a whole baby. Wait a minute, that's a couple babies. It's like a Shaq baby.
It's a big baby.
Yeah, I was. I had a lot of hair. Surprising. All right.
Anymore. So thank you for coming on, Dr. Christle. Awkward silences.
It was that.
That was not awkward to me. I didn't feel I did not feel awkward by it at all. But
Oh,
There you go.
So, I would love to know, especially for our listeners, how do you usually describe like who you are and what you care about?
I think that really depends on who I'm talking to and where I'm at. But for the most part, I'm just, I'm a part of the team. I'm just here and I'm here to help out, and whatever you kind of need, I'm willing to just get in there and grind. I don't know. I don't ever like to pop off with like, yes, I am a physician. I am board certified. Like that's just never been like my thing. I'm like, hi, I'm Christle. I'm, the medical provider, but like, this is how I operate. Like, I'm going to be supporting you guys, but I'm not going to be in your face about it. So if you need anything, please come up to me. But I know as like, I guess I'm speaking specifically with like athletes. I'll give them my spiel. Like, I'll be hiding in the corner, but I'm going to be keeping an eye out on things. But I know that as athletes, there are, especially when you're in competition, everybody's got their own kind of prep, their own quirks, their own kind of mindset. And so I never want to impose. I'm always going to be available, but I'm going to be hiding in the corner. And I'm always, if a parent needs me, if, the team leaders need me or the staff needs me, I'm always here too. Like, I'm just a part of the team. Like,
Nice. Yeah.
Do you find it natural just peeping from the corner?
sometimes there are taller people, because I'm 4'11", so I kind of have to like, a little duck and weave to kind of, make sure I see everything. But, if you stand in the corner, you got a good line of sight for the entire room, whether it's the warm-up room or the competition space, depending on what sport you're looking at.
Okay. Yeah, Nas like to usually sit in the corner, but
Yeah, I just like to watch. Don't laugh at that.
there's a name for that. But
There is. I like my chair. I'm
not
done
gonna
with
mention
this.
it.
I'm done with it.
Now you gotta get a chair for your corner.
I go.
It's already there.
I know. Not like ass.
So how'd you get into like the athlete space? Like,
Yeah.
did you grow up being an athlete? Did you just like watching sports, or like did it just like come to you one day and you're just like, oh, I love being in this atmosphere?
Hell yeah.
It didn't come about all at once. I mean, I played sports as a kid, and I played volleyball and basketball because that's what was available. And then I did a season of cross country. And then I got kind of sidetracked and got into the wrong crowd in high school. And then got to college and sort of realized, I kind of maxed out height wise in the 4th grade, sort of realizing like genetics kind of had to, a role. Like, I think I was in 8th grade or 9th grade when I saw a girl in high school who was like 6'10", and I was like, oh, like this volleyball thing may not be for me. So when I got to college, I was like, I loved being an athlete. Maybe I want to work with athletes. Maybe I want to go to PT school. And then I got hooked onto chemistry and math.
As one does.
Yes, exactly. Super fun. And I decided that I wanted to be a professor of chemistry, teach organic chemistry, do organic chemistry research. And so I ended up applying to grad school for organic chemistry, and then went to Wisconsin. I did my undergrad in San Francisco at SF State. And then once I got to Wisconsin, I kind of realized that I liked the idea I liked being in the lab. The lab was sometimes pretty lonely, especially in chemistry, the whole chemistry setup. And then as a professor, I would be doing a lot of grant writing.
Mhm.
And I really just didn't think that far ahead. And so I ended up leaving with a master's and a publication, and then decided that I really liked talking to people and interacting with people a lot more, and sort of the whole helping people. So I explored like, where in healthcare could I go? Was it nursing school, nurse practitioner, physician assistant, or physician? Did some soul searching, and then ended up applying to med school in my late 20s, early 30s. And then going into sports, that whole, I loved being an athlete. I liked taking care of athletes. That's when I decided, in med school, like, I'm going to do sports medicine. And then within sports medicine, there are a couple of different pathways to get to that. You can go into emergency medicine, you can go into surgery, and then do a fellowship in sports medicine. And I ended up going into family medicine just because I liked the variety of people that you get to interact with. There's so many random things, like, and you have to just know a little bit about everything, and you have to know when is something out of your scope of practice. And it's really important for you as a family medicine doctor to know who the specialists are and why you are going to refer to them, because otherwise you're just not really actually practicing medicine. You're just referring out all the time. But I really like the relationships, not just with the patient, but also with the providers. So
Okay.
it seemed like a natural fit.
That's a lot. By the way, when the dog was standing there, Spence, and the dog was like standing up,
Yeah.
it was standing up, but it was like kind of sleep while standing up. I was like dying inside. I was like,
I can relate.
it's a fine.
She just had cruciate ligament repair surgery about a month and a half ago. So she's doing great. She just
She's doing good. Don't worry. She's fine. She's fine.
she's fine.
Jesus Christ.
All right.
Just her and Patrick Mahomes on the same table. Okay.
And then,
Jesus
if
Christ.
only.
If only.
I bet your pup probably got better care.
Jesus.
So, you just relayed like all of your journey and stuff like that. Was there any part of it that like just surprised you, like now thinking about it from your perspective?
I think COVID really caused me to reevaluate what I wanted as far as a traditional practice goes, and kind of what my expectations were in medicine. Because I was a third-year family medicine resident when COVID finally hit, and then I did my sports medicine fellowship with the whole COVID pandemic. Moved to Vegas, and just everything was, kind of topsy-turvy. Nothing was right. Like a lot of sports were canceled.
Yep.
And then, kind of rushed, the football season was truncated, and then they took all the rest of the fall sports and kind of dumped it into the spring. And so it was cool in that, yeah, you just kind of had to roll with it, right? There was nothing else you could do. You can't be sad about it. You can't be mad about it. So it's just like, well, we'll just do it live. We'll see what comes about this. But by the time I graduated, I was pretty burnt out, and I did not want to do medicine at all, to be quite honest. And that's when I ended up doing a marketing internship, and I was like, I just need a break. I need a complete and utter break from patient care, and I'm going to start interviewing customers and seeing what they like and don't like about products, like something but at least I get to talk to people. But it's not about medicine. It's not about being sick or something like that. It was just something completely different.
Do you still feel like that sometimes? I mean, like, like you have obviously like your getaway time and stuff like that, with like, especially maybe with lifting or anything like that. But like, do you still kind of feel that way sometimes, or you're just like, I just need a break?
I actually think I'm ready to go back this year.
To go back where?
So I don't have a traditional, like, I don't work in an office. I don't work in a clinic right now. I have a small telemedicine private practice that's not really like accepting new patients. And yeah, the last couple of months, I was just doing some soul searching and really wanting to go back into a community health, something like a community health center, like a FQHC, like a federally qualified health center. And you just kind of, miss that practice of medicine. I mean, that is real family medicine. Here in Upper Darby, which is pretty close to Philadelphia, it has a high immigrant population, and you see a whole variety of people from a variety of different countries and languages that I had no idea existed. And so you got the translator phone all the time. You don't even know, like, I've learned so much about the world. Geography is my worst subject, by the way. So I've gotten lost in a parking lot before. Like
you're 4'11", girl, you can't see shit.
So right. I need a booster chair for the car.
Oh man, I ain't gonna say all that now. Calm down. I said he's a white supremacist. Wait a minute now.
But
Go
She's
ahead.
short, but she's buff, you know. So like,
She'll
so
get
really, your legs take the most damage usually,
Yeah.
you know.
Yeah.
Yeah.
Yeah, exactly. So
there.
we'll
So,
see. We'll see what my plans are for this year, for 2026. It's 2026. Yeah.
yes. So what is the soul searching? Is that just you, a friend, you and a partner? Is that the dog? Is that family? Is that friends? Is that therapist that's helping you
Um,
soul search? Or is it
so
just you and yourself?
it's just right now, it's just me and myself.
Yep.
Just getting things sorted out here in Philadelphia and, just myself and the dog Gwen. And so, it's not that I'm opposed to therapy. I just haven't, like, I've been searching. I've actually been searching. I'm like, I just don't know. Like, you have to look online and, make phone calls and kind of see
No, sir, I ain't making no
do
phone
all
call.
that
You one of
logistical stuff.
those. You ain't
Do
making
all
no
that
phone call.
logistical stuff. Do all that
Yep.
logistical stuff. So,
Have you ever had therapy before with all the stuff that you've talked about?
yeah, not necessarily with the food noise stuff, but just other things in
Oh,
life.
stuff. Okay.
Yeah.
Okay.
I didn't, I guess I just didn't realize how much, yeah, the food noise just made it so possible that now I'm actually starting to like look at like, what do I want? How do I want to show up in the world? What do I want my relationships to look like? And having those conversations too, because I think especially as an Asian female, I think it's hard. I feel like, especially talking to a lot of my friends who are also Asian, that having those conversations is just tough. I think it's tough no matter what, but I also think for me, it's just been really difficult to like, it feels like when I ask for stuff, it's always just been like, I feel like I'm imposing, or at least growing up, I always felt like me asking for my wants and needs is just being too much. And finally coming to the understanding that no, it's not, too much to ask for um really, what it is that you want. Somebody can say no and you can have a conversation about that, and that's okay. And they might not agree with it, and that's okay. Like, that's not the end of the world.
Okay.
What's the worst thing that can happen? They say no. All right.
Yeah. All
All right.
right. Yeah. Right. So I kind of want to touch on this a little bit, but we just had on Alicia Pelton, who is a program director for this program called Coaching Her, where they bring in education to coaches, specifically talking about girls and trying to keep them in sports.
Yeah.
And she talked about like all these different sacrifices, that she had to make. And we've heard that a lot, especially coming from a lot of our guests who are women, of just like these things of sacrifices for other people, or having to try to be perfect in an imperfect world. And did you feel like that when your career, like, I have to be the best, I have to be perfect, or did you kind of, yeah, I'm assuming yes.
from my from
That's a
my
yes.
oh yeah,
No,
if
please do.
if I could just be the best at everything else, maybe it'll make up for the fact that I have this like dysfunctional relationship with food, or like this insane food drive, or this insane hunger that I had no idea what the heck it was. If I just excelled at my career, if I just did all of these things, like maybe it'll make up for the fact that like deep down inside, like this thing is just eating me alive, and I don't know why my brain is broken and why everybody else seems to just eat a little less and it's okay. But eating a little less takes just so much cognitive bandwidth. It just takes up so much space and mental chatter and it was so hard to describe that to people because, for a long time it's like, oh, just willpower. You can just willpower your way through it. Well, I've tried to willpower my way through it, and just it has I've even failed medical school anatomy because of it. I just like
Because you were just so hungry?
oh yeah, so I had dieted down from 150 to 130 pounds, and I was in a calorie deficit for about a year. I was doing like 45-minute cardio sessions 5 times a week. I was lifting 4 days a week, and I was just not really eating a whole ton of calories, but I couldn't go to sleep because my stomach was so audibly loud. Like I could hear my stomach growling at night. And the hunger pangs would just keep, like, my belly was just uncomfortable, and I would just keep tossing and turning, and then I would show up to anatomy lab just like a zombie, because you're purposely starving yourself. Your fat loss is, a strategic way of removing calories and just starving yourself. So your brain's just not really functioning. So there's trade-offs to that. And so, yeah, I failed by a couple of percentage points, and that just triggered years of panic because I had failed this one thing. I, passed on the second, attempt, and everything was fine. But there was always this nagging, like, chip on my shoulder. Like, I need to make sure this never happens again. So I had this, like, sense of urgency and, like, this, like, anxiety about me that I couldn't quite shake, because I just was in, go, go, go mode in med school, like everybody else.
I assume you've always been a grinder, though, huh? You've always been like good at smart at all this stuff, or you said you got involved with the wrong crowd? I don't know what that is. That's like, it's like
Yeah,
the anime kids, or that's
Throwing rocks at buildings.
No, it was the kind that cut class, the kind that, would go drinking, on the weekend. We'd find somebody to buy us alcohol so we can get drunk on the weekends, or drink in the middle of the day.
Okay, look at you.
Yeah. It was, smoking cigarettes, pack of Marlboro Reds was like $2 a pack in the 90s.
Oh yeah. I don't know.
So gross.
The good times.
Marlboro's just like,
yeah. Oh gosh.
Unfiltered.
So yes. Exactly.
Jeez.
So
okay.
But yeah, I had a couple of years of bad grades, but it wasn't until I got to college and I got a C+ in general chemistry, and I was like, you know what, I'm done with this. Like, I did not get to college. My parents did not come here from the Philippines to just, have me, like, throw this opportunity away. So got my shit together and applied for every single scholarship, research fellowship, anything that was free money with an application. I was like, please, let's throw my hat into the ring and let's go. So
we're grinding. You tired? I assume you're not tired right now because you're thinking about going back into community mental health type stuff.
No, I'm not tired. Yeah, the last, moving and really just thinking about just the absence of noise and having the space to really think about how I want to show up and what's important to me has been very energizing, but, like, not in the way, but in a quiet way, and, like, thinking about what's important to me. And I think for a very long time, especially with the food noise, it comes, and also people pleasing has been a very huge, like, for, a number of years. And so that has since, stopped. And with that has brought about a peace I didn't know existed.
All right. Nice. I guess, like, we can get into, like, what's been your journey with the GLP-1s? Like, what made you want to start it? Also, like, did you have any, like, hesitancies about it, taking it? And yeah, just let's hear what your journey was.
Oh yeah. I started medication not a GLP-1, but I was prescribed a bunch of different medications for weight management. I think that started in residency. I first started, I think it was Contrave, which is prescribed for weight management. So that's bupropion, which is also used for
ADHD.
ADHD, smoking cessation, also for depression, anxiety.
Yeah.
And so, And then also is naltrexone. And so that ended up with severe hives. So that's a no-go. Yeah, good stuff. I was prescribed topiramate, which I think is prescribed for seizures. I forget off the top of my head, but that gave me really terrible word forgetfulness. So I would be in clinical rounds and just I'd have the paper in front of me and I would just blank out. So that was terrible. Did nothing. None of these things did anything for my hunger either. Bupropion by itself still didn't deal with my hunger. And so that was that. And then in sports medicine fellowship, my doctor was at the time was like, hey, this Wegovy thing is out. Like, maybe you should give it a try. And I said no. I said no the first time. I think a couple of different reasons. One, the cost was terrible and I had student health insurance, so it was going to suck. And it wasn't, I don't know, I don't even think it was covered. I think there was coverage problems anyway. Two, it was an injection, and the rest prior to that, all the other medications were pills. And so I didn't want to I don't want to poke myself. Even though I've gotten my ears pierced and it's not a big deal. Needles aren't a huge deal to me, but I just, and then I think I was still in the mindset that okay, all these other medications didn't work. Maybe I should just willpower my way through it. I just had a lot of ego at the time. And so I said no. And then, I really started to think about it. So 2 years after.
Uh-oh.
Body.
You just came back. You lost out. So you said 2 years after, and then you cut out.
2 years. So that was in 2020 when I said no the first time. And I think 2 years later, January of 2022, I decided, you know what?
Okay.
Think about all these other modern conveniences we have in this world. Air conditioning, cars, other medications that you have taken. Just because those other ones failed doesn't mean that this one is going to be a failure. And I also noticed with bodybuilding contest prep, I saw how food focused a lot of them got towards the end of as their calories dropped. I saw how very food focused they got. And even after the post show, how difficult it was to manage their hunger. And so I was really thinking you know what, maybe I've just been handed these genetic cards where I'm not bodybuilder lean, not even close, not even trying. And there's just something about whatever calorie deficit that I am trying to achieve. My body's like, nope, we're going to keep you at 165 pounds comfortably, comfortably over fat or chunky or whatever you want to call it, at the time. Snoring.
Snoring. Goddamn, girl, stop calling shots at me.
No, and that was me. And so I was like, you know what? Let's just go for it. And I remember that shot. And I remember what food was like after that. And it was the most surreal experience. It was like the wildest experience. I don't know how your experience has been with, being on this medication. It was like I was out to eat. I ordered a steak, I ordered a glass of wine, and there were some side dishes. And it was just sort of prior to that, I wouldn't have been paying attention to whatever it is that you were saying or whatever it is you were asking, because I'd be too busy thinking oh my God, I can't wait for this food to come. Oh my God, the food is here. Oh my God, I got to make sure that I'm not shoveling this food down my, gullet, because I don't want to look like a pig. And I just got to make sure to drink, glass of water, in between bites, make sure to chew 20 to 30 times. So to maximize your,
counting your chews. Shit.
I mean, there's
You're
all
just like
sorts.
1-2 and then it's down.
Yeah,
Yep.
well, there's all sorts of like stuff that the online fitness space like spews out with like
Yep.
make sure you take a glass of water, make sure you chew thoroughly,
Yep.
make sure you be present and mindful with stuff. And I'm just like, no, I have this like conversation in my head, and then I feel guilty because I'm not doing all the things. But then like I really just want to like, and it was like I just none of that. There was no. It was like, oh, I can just calmly cut this piece of steak and chew on it, and I can have this conversation. I can enjoy the conversation right in front of me because I'm not focused on my plate. And so like I look down and I'm like, oh, I think I'm full, and there's still a couple of bites of steak left. There's still like a little bit of the potato, and there's still some broccoli, and the glass of wine I did not finish. I was like, what is this? Like, I am the clean plate club girl here. I've always been the clean plate club ever since I could, as young as like 2 or 3 years old. So what is this like?
Damn. Give me that breast milk. I'm sorry.
Right?
About to finish this bottle real quick.
Right?
Bottle.
Exactly.
Bitch, that's a pint. Let me get a tall boy. I want milk.
Oktoberfest over there. Jesus. For breast milk.
Yeah. Girl. Okay.
Yeah. So
Did it fade immediately with the first shot, or did it fade? It take multiple weeks.
I can't remember off the top of my
That's
head.
fine.
I mean, so the trip, I remember that dinner was maybe about 3 weeks after I started.
Okay.
2 or 3 weeks. So
Okay.
yeah.
Yeah, for me, I'll get into it at a different time on
Yeah.
a different podcast. We want to talk to you,
Yeah.
but like,
Yeah, totally.
Wegovy didn't work with me. That shit was terrible, man. I'm one of that small percentage, horrible effects, and so my stomach was ravaged.
Yeah.
But then the Zepbound been fantastic. It is making me a little bit tight for that one day, but everything that you're saying is like factual.
Yeah.
Like, I don't need to eat. I don't feel it. Man, I'd be so hungry at night. At night, right before bed, I'm like, I'm gonna go to sleep. I'm tired. And I'm like, oh shit, I could eat. But then I get angry. Like, I get angry in the bed and like fucking mad. I'm not gonna eat. I'm not gonna eat. Fuck, I'm gonna eat. And then I gotta go eat.
Yeah.
And then I eat not a small meal. It's 1,200, 1,500 calories. So that has stopped. Okay. Which is like wild.
Yeah, like
to not be eating 4,000 to 5,000 calories per day. Like, people are like, how much do you think you eat? It's just trash, isn't it? I'm like, no, my dad's cooking home cooked meals. Like, I'm eating like a fucking king.
Yeah.
It's just way too much food.
Yeah.
That noise thing is wild. I try to tell clients about this that don't know what this is. It's kind of like when they take ADHD medicine and their brain finally like calms.
Yeah.
And the noise isn't there. And then one of my boys said recently, he said, Nazeer, it's crazy not having all the voices in your head. What was you talking about now? What was it? They telling you to do things? Mm-hmm. And he said, no, man, it's like, I'm just driving the car and I'm just chilling. He's like, now I understand why people listen to podcasts. Because I'm just fucking just sitting there. Otherwise, it's a million things that he's tweaking out about.
Yeah.
So I related your story to his, the food noise.
Yeah.
Question is, someone who's been on it, did you go up in the doses like most folks do, or did you stay at one dose? Did you lose weight pretty quickly, right? Or did it take a while, plateau? What was that journey like? Did you have side effects?
Yeah, I had side effects. I was actually just thinking about it the other day that also started doing jujitsu around that time. And so trying to do, learn a new sport and then have to deal with this drug and side effects. And I couldn't quite tell which one was like attributing to which. So, cause there's a lot of tumbling and like literally rolling. And so I got very nauseous and dizzy at first when I was on the mat and not sure, how to manage that. So I had to really start thinking about what it is that I'm eating and being a lot more intentional. Otherwise, I'm going to vomit all over my training partner, and that would not be that would not be great. But
no.
Yeah, a little bit of heartburn, a little bit of nausea. I did vomit once when I was in Mexico, and yeah, throughout my post work or intra-workout shake but I made it to the bathroom. But
Were you on vacation in Mexico?
yes.
Girl
And
was on vacation and still taking a workout shake.
Gotta keep it going. No days off.
Yeah.
it's just a little something. It's just a little something. And then
I just need a little boost.
Give me my vitamins.
My vitamins.
Yeah.
You know. I know why you're in Mexico.
She's clean,
It's cheaper
everyone.
there.
She's clean. In
Oh,
case everyone's
gosh.
listening to Doping Committee, she's clean.
Gosh. What was
Sorry,
it?
Doc. We feel you.
No, it's all good. No, it's all
Sorry,
good.
Doc.
It's all good. And then the side effects, well, in Mexico, it was like, oh, I definitely, alcohol is like,
Yep.
no. Like whatever it is, like whatever I thought I could like comfortably handle, I had to cut that in half. So,
Yep.
yeah, but it got better with time.
Yep.
And also with the dosage, at least for me, I did not need to go up super high on the dose. But I think the other thing too was I really wanted to make sure that all of the things that I had sort of picked up along the way from the fitness community and how I structured my diet is to make sure that I'm not starving myself. I'm not completely eliminating all hunger and food noise. So I'm not eating. I just wanted to make sure that like I could at least take it down to a manageable level. So I'm still eating full meals, but the noise is just like gone. Like before that, I would eat these meals and I would already be thinking about the next meal. Like what am I going to eat? Yeah.
Obsession.
Oh yeah. Obsessed. 100% obsessed.
It's a bitch, man. We laugh, but it's a bitch, man. You get so nervous and anxious and then compulsive, and then your compulsion isn't always eating. Sometimes it's just the thinking.
Mm-hmm.
And people don't get it.
Yeah.
They go, it's just you just don't think about it. Oh yeah, let me try that. Yep.
Yeah. I just sit there and chew on my nails and like try and pretend to not think about it. And I'm just like, oh gosh, yeah. Or I'll eat my entire day's worth of meals in like 4 hours and then still be hungry and then feel like a failure because I'm still hungry.
Girl.
Nothing like looking at empty containers with shame. Like, fuck.
Dude, I would take my lunch to work and I'll smash that motherfucker. If I don't have any clients, I'll smash that motherfucker at 9:30, 10 o'clock.
Yeah.
And I just look at myself like, I'm fucked. I got to go the rest of the day.
Exactly.
And I just sit there like eating fucking Cheetos out of the drawers of my fucking work desk. Like, I got any mints in here?
Jesus Christ.
Oh, it's horrible. Like,
leftover Cheeto crumbs.
I got any fucking ketchup packets? I ain't gonna lie, bro. I ate a couple ketchup packets in my day.
Oh man.
Oh, it's a bitch, bro. People don't know the grind.
What, you
bro.
stuck in a fucking van in the middle of the woods?
You should also
Sopranos,
know,
people. Sopranos.
there you go. My autistic ass don't like leaving the office. Like, so I'll be in this big ass building, all these offices. I don't want to go out there because then I got to talk to people.
Yeah.
So I just be in my office, like. But if I got clients, I'm good. If I got clients, I ain't paying attention to it. As soon as that client goes, I'm like, damn, I'm done eating. Spencer knows I can barely do a podcast without fucking fixating on food.
It's true. We have a counter, and I swear at 1,000,000. I don't fucking know.
It's usually like 3 to 4
Potato,
times
and I'm like,
per
what?
pod. 3 to 4 times per pod, I'll talk about food. Now the noise is quieting a little bit, so now it's like, toys.
That's right.
I still like food.
Good.
Spencer, go ahead.
Oh, thank you. Appreciate that. So, yeah, I want to back it up just a little bit. It's like, so you talked about like bodybuilding and maybe, I'm not a bodybuilder at all.
Neither am I.
You're a powerlifter or a bodybuilder?
I mean, I competed in powerlifting for a number of years. I don't compete in powerlifting anymore. Needed I needed a more gentle sport. So now I'm just kidding. I'm just a recreational athlete.
So you went to MMA?
No.
Jiu-jitsu.
No striking.
went to
no striking,
jujitsu.
You
no
roll
striking, no
around.
kicking. Yeah,
No striking,
yeah,
no kicking. She
yeah.
just wanted a
Rolling
cuddle.
the hay. You rolling the hay.
Little struggle cuddle.
Pretty much.
Aggressive hug.
Yeah.
Aggressive.
Just I got you.
Have you ever seen those memes where the dude's doing the flies, the cartoon? It's a little cartoon drawing, and he's doing the flies, trying to, and they're like, "What is this for?" And he's like, "For hugging."
No.
I'll clip it into a YouTube video.
I'm
It's
like,
actually
I
very cute.
love how you try to act like we're one of your clients who's like 12. Like we have you seen this meme? No, I haven't.
You're such a dick. You're such a smelly
Have you
dick.
seen this meme before? No. I'm not 13 on TikTok. Jackass.
I mean, if it's a
Eddie.
TikTok meme, I haven't seen it, but if it's been on a forum from like, the 90s, like early 2000s,
Yes,
2000s, yes.
I'll send it to you, Doc. I'll
If
send
it's
it to
a
you.
really like sketchy looking GIF, I got it. Right?
Right? Oh, yeah.
I got it.
It's a little pervy. I got it. Okay.
Hey,
Fuckers.
if it's a little, if it looks very blurry, I got it. Yeah, we're there.
I probably have seen it. I probably
Yeah,
have seen
Jesus.
it.
see, need the blurry
Pixelated.
memes. Get the
Pixelated.
blurry memes.
Yep.
So let's talk about like the fitness world, right? And the things
Yeah.
that the imagery that people have to kind of keep up with, and the crazy, just over the top things that people have to actually keep up with in order to like keep on this. It's like for you, it was something of like, wow, I have to count how many chews I have. Like that's literally a thing that people do. And so what do you think is something that people can take away from the fitness world to like maybe have something less, I don't want to say toxic, but feels kind of toxic-y, like it just feels like you have to do so many crazy things that you never would think of doing in your life. Instead of enjoying something and just being in the moment, you have to keep your mind occupied with something. Like what was something that you would say to people in like the fitness world to maybe get it less like that?
You got to counteract it.
I think there's a lot of things, in the fitness space that we could do a lot less of. And definitely, I think the food noise thing is actually a real thing. It's not some made up woo woo. And I think when I first started talking about being on a GLP-1, I was like, you know what, screw this. Like nobody else is talking about this.
Mhm.
I have gone through the 90s and early 2000s with all sorts of like screwed up diet culture,
Yep.
failed all the commercial diets. If I could go back, and now that these medications are here and they're real and they can help so many people, I want, yes, they have side effects. Yes, it's a nuanced discussion, but the fitness space really at first was very like, oh, this is
Yeah.
cheating. You're cheating at stuff. And I think that comes from, a couple of different places, one of fear, but also just one of ignorance. So I think, yeah, just having a little bit more compassion for people when they talk about, their struggles with hunger. It's not just like just suck it up and do better is one thing. And not everybody wants to, have like, everybody has a goal. And whatever somebody's goal is, I think it's important to meet them where they are and then move forward. So for example, there's recently I saw on social media that, you can't do it for vanity. You can't be on a GLP-1 medication for vanity. At 4'11" and 190 pounds, I'm sorry, there was a vanity component to it. Like,
Yeah.
and that was my truth. And I think you miss an opportunity to build rapport with somebody if you automatically just shut that down. So, and because, as my journey moved on, yes, it became losing weight became way more than the weight itself and, the vanity aspect of it. That's actually the last thing, but you have to do the work and actually go through the journey and go through the process before you can get to that. Some people, it takes a little bit of time. And so if I would just say that out loud and somebody be like, no, you can't do it for vanity reasons. Well, I just would like kind of shut down and I would go somewhere else. Like, or I just wouldn't say anything and I'd feel really shameful. Like, so, and I think a lot of people start off with those sorts of kind of goals. And the more you talk to people and the more you invest in, build that rapport, it really does become a lot more than just, the looks portion of it. But you have to talk to them and you have to, acknowledge them and be like, yeah, I hear you. Like, let's, build some healthy habits and let's see where this goes.
Yeah, the world is, I want you to dig into more about, women.
Yeah.
Because I got a lot of clients, a lot of ADHD, a lot of autism, right? That's the specialty here. And a lot of my folks are overeaters. And we're working on this. Yeah, we want to look good, but we also want to sleep better. We want to walk
Yeah.
better. We want to have more time to be with our dogs, our pets, our animals.
Yeah.
We don't want to be fucking fatigued at the end of the day every day.
Yeah.
We want to have a little bit of sauce at the end of the day so we can actually be a good wife or a good husband, good partner, whatever.
Yeah.
There's a million different reasons why. So you though, the girlies, getting to what Spencer was saying, what are some of these negative things that they're being told? I think Spencer also said all this athletic experience that you're working with these athletes, what are the things that they're telling you or the things that you would tell our clients to counteract that? Like, because a lot of women listen to the pod right now. What do you talk to your clients about and try to be more affirming about and write their journeys? And then what would be your advice to like people listening to us today, besides just GLP-1s, just body, weight, wellness, positivity, right? Goals. What would be advice, Doc?
Man, if I had the one thing that I would say to women out there and girls out there is the weight room is the most amazing place to be. And if you could give yourself 2 days a week, 30 minutes a session to just pick up something heavy. And yeah, it doesn't take a whole lot. But I think it's going to do so much for your bones, your tendons, your muscles, your strength, your confidence that that is always the correct answer. And whether you are a child, because it's totally safe for kids to lift weights, and for women in their 80s, 90s and beyond. So I think especially in the 80s and 90s where we was just like, do all the cardio, do yoga for these long, lean, muscles. And it just doesn't work like that. So it really requires you to challenge your body in the weight room. And I wish I would have learned that in my younger years. It's never too late to start. But you can still build muscle and build strength if you start in your 60s or 70s or even 80s. But the earlier the better.
There you go.
Mm-hmm.
Thank you.
Yeah. I guess like anytime I hear like people going like, hey, like you should go like, lift some weights and stuff. They're like always like, oh, I don't want to get too jacked, like I don't want to get too buff. And I'm like, okay, first of all, like it's not how that works.
Doesn't work like that.
Like that. Like I go to the gym, I'm not like, built like that. What do you think? Like you are gonna do there too? Like, but I like that. Advice.
I was gonna say the same thing. That's what a lot of my girlies say. I don't want to get too big.
I don't want to get too jacked.
I'm like, girl, you hitting some trend? Like, what the fuck you talking about? Like, you an animal? Like, you ain't
right?
You ain't getting thick like that, girl. God bless you, but
it doesn't work like that.
You ain't eating no Popeye shit, girl. Like, but I don't want to look too masculine. And I'm like, girl, stop.
Girl, let me tell you. Let me tell you about these drug stacks, and you're not on them.
Oh my God. Facts. But that's like a thing. And so how do you combat that when some of the girlies are not wanting to get too big, like Spencer was saying, or maybe like folks think that they can put it on immediately? Like, is that a thing you have to work through with folks?
Yeah, and sometimes I'll ask them, show me a picture of what you want to look like. I mean, if like, even though I know deep down that you're not going to look like these people because your genetics are like, you're not going to look like J-Lo. But I can think about, and we'll go from
J-Lo. That's fantastic. I knew you
Jenny
like
from the
Latinos.
old.
I knew you. I got you. No,
I was surprised you didn't call her Jenny from the block. You're just like Jenny from the block. What?
Yeah, you could have said any of the young girls. No, she was J-Lo. I see you, girl. We all got Latina crushes. I got
Grew
you.
up in the 90s in California. And you named a New Yorker? What? Who are you?
Nice little Puerto Rican too.
Jeez.
Yeah, we all got our crushes, girl. I got you.
J-Lo
Yeah.
for the block.
I also think about I'll ask them what,
Go ahead.
what are your, if you have like physique goals, if you want to
Yes.
look like something, what would you like to look like? And then we do, depending on where they're at, I'll talk about building muscle and how, the example I also try and give is, I have seen this with a lot of older women who don't strength train, and they're in their 60s or 70s, and they come to me with their like arms, and then they do the little flappy thing, and they're like,
The
how do I
bad.
get rid of this? And I'm like, you get rid of it by building the muscle so it fills up that space that you're flapping at. So like, and legit, like it's like bone and a skin, and there's not a whole lot of fat to fill it in. And
Yeah.
so what else can you do? Build muscle, which requires putting on weight, which requires resistance training, to kind of get that kind of toned look that you see on some of like Shape magazine or something, or like one of the women's health magazines.
There you go. Were you lifting before you were losing weight on GLP-1? Yeah, you said you were already
Yeah.
lifting. Yeah. So were you doing the powerlifting when you were in college, or was that after college?
I was not powerlifting in college. In undergrad, I kind of went all in with eating. I just decided that I was going to be the best student ever. And so I put on a lot of weight in undergrad. And so I graduated from San Francisco State at like 200 pounds. And so, yeah, I didn't pick up a barbell until I think I was a grad student. And it was like 2008 or 2009. I did a half marathon just to challenge myself and like get into shape. And then I was like, this is just not for me. Like something about this just, it was good. It was nice. Like I did it. And then I discovered that what I really wanted to do is pick up a weight, because at the end of the marathon training, I didn't do any strength training. And I was like, I don't have any muscle. Like, so I'm going to just build some muscle. And then I went into the weight room, and then that was just sort of it.
There you go. And then you got like
Some muscle.
I feel,
Yeah.
but you got a little addicted to it too. Like everything you do, it's obsessively. I feel like it's like you're a grinder. You're not doing nothing half-assed. You're like all or nothing, good or bad. Like if it's smoking the pack a day, like you were doing in high school.
Yeah. Fair enough. Yeah.
You were not smoking a pack a day in high school.
No, in college I was, though. In college, and it wasn't a Marlboro Lights. It was Parliament Lights by that point. Like I had money. I had money at this point.
Oh, that's the good cigarette.
With the recessed filter and everything.
Whoa. Have you tried weed yet?
What?
Don't answer that. I said, have you tried weed yet?
Oh, jeez. I think, is it decriminalized here in Pennsylvania? It's like state by state. I know it's recreational in Michigan.
Yeah.
No comment.
Please, you can smell that shit from the border.
It's for nausea. It's for nausea.
I go to Chicago. I'm like, oh shit, there it is.
It's intense.
We're near Michigan.
It's intense.
I smell it.
Yeah.
That's in Chicago.
Yeah, it's intense.
Okay. But what would you say for somebody who maybe like took a step back, right? They overeat or something like that. They're on their diet and then they overeat, or they have like a day where or a couple days where they just, go over that. Like what is something that you would tell people who are just A, trying to get back into it, or B, they feel some type of shame about like taking that step back?
Yeah.
That's a tough one there.
Yeah, it is. If they're, first off, really just, acknowledge and thank them for even saying anything. Because a lot of people won't say anything. They'll just pretend like it didn't happen. So I'm just like, I just want to take the time to just, thank you for being honest. And I actually had had a colleague or client that was talking to me about, she is a mom, of 2, and her daughter had a birthday, and they had a party, and there was cake there, and I guess it was like it was like an awesome cake, like whatever flavor, style. Yeah, right. And she's describing this cake, and she was just like, yeah, I had this piece. And you could tell in the tone of the voice, there's a little bit of shame, involved. But it was a small piece. And then, and then, I was like, and then what? Like, and then, I had a drink, and then I, kind of went back to my regular meals, the next day. And so I was like, pause, you acknowledge that you had the cake, you had the cake, and then, but you also then moved on. And then, so I would say for somebody who had a couple of days, um, you know, they're checking in, they're actually telling me about this experience. And then I think that's, a great first step. And that's expected. It's expected that, especially when you're having behavior change habits, like there's going to be ups and downs, and people are not going to just be able to have that cake, enjoy the cake, and move on about their day. It's going to take some practice. They might have have the cake, and then for the rest of the day, or even 2 days, decide like, oh, well, like, fuck it, right? Like, let's go all out. But you know what? You're here now. Like, you're here checking in with me. You're telling me about this. And like, it is what it is. So I think normalizing it, because that is, completely expected in anybody's journey. And even, moving on, like even for somebody who's like very well advanced in their journey or whatever it is, like it's just expected. You're going to have a day, a couple days where you slip up, or even seasons where things just aren't really, like, you have other priorities. So I think being able to normalize that and being okay with that, and making them feel okay about that, and sort of just moving on and kind of dealing with it.
What do you think was the most helpful in your journey? Thank you for that. What do you think is most helpful in your journey, and how can we relate it to, like, the other folks today listening? What was the most beneficial? Was it support from friends? Was it the medicine was just good? Was it following through? Was it meal prepping?
Cigarettes.
Cigarettes and porn. That's all it was.
Oh,
I'm sorry.
When you you look
The
at
dog
Glenn,
woke
she's
up.
like,
Wait a
oh,
minute now.
You say porn?
well, she's so,
You
oh my
freak.
god, she's so oh my god, she's so drowsy.
It's definitely drowsy. You're definitely drugging this dog. I'm gonna report you to the dog PS.
I did give her the gabapentin. She had a little bit of a limp today because
See?
because it's the snow. It's the snowpocalypse, and so she decided to just like jump into the snow and take me along with her. So,
Everyone watching just gonna be like, something's wrong with that dog.
That dog's not okay.
There's a yoga by Adrian on YouTube. Have you ever seen or done yoga by Adrian on YouTube or no?
No, I have not.
She's fantastic. Love her voice. Love her as a person. The person she perceived to be on YouTube.
Yeah.
She out of Texas, does yoga. We did it during COVID with the volleyball team. They're like, hey, we ain't got nothing to do. I was like, shit, I'll do it, y'all.
Yeah.
She always got a dog. In every yoga video, the dog's there. It's like fantastic. So any of my kids or girlies that are like, I'm like, just do it with the dog. You'll like the dog.
Yeah.
It's always sleeping in the corner, like getting up, and she just goes with it. That's what this reminded me of. Except your dog's a little bit more dead.
She's not. I promise, she's not always like this. I promise.
One day you're on camera.
Yeah, I promise. Your dog's got.
She's like, mommy's so boring. All she talks about is GLP-1. Blah, 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 food noise.
I promise this doesn't ever happen. Like, sure.
Right.
It's fine. They got pills for that.
Yeah. Yeah, no, I mean, one, the medication definitely helped, but I think two, having a really good support system and friends that what I would describe as just having radical honesty with. I think being able to have messy, honest conversations and want to do better and always wanting to evolve. has been super helpful in this journey. It has helped me find the courage and the voice to start doing things like setting boundaries. It is, and to apologize. I think moving forward, the biggest thing that is important to me is in friendships and in any relationship is how quickly can we move past conflict and repair it and move on without, damaging each other's character. That has been like super important to me in regards to, just this whole journey with, not just the medication, but just how I want to exist in this world. Yeah.
You're big on interpersonal stuff, huh?
I mean, yeah, because now that the food noise is gone, I'm just like, oh, I have all this, there's just this space that's in my head that I now have the capacity to start doing that. Cause I know, and everybody's different. I know some people have started therapy very early on in their journey before they even start thinking about weight loss. Some people pick it up along the way. Some people start doing the inner work. I know that there was also a lot of narratives in the fitness space that was like, you need to do the inner work first before you can do the outer work. And I'm like, that people aren't perfect. There's no right way to do stuff. You have to, everybody's different. You have to start somewhere.
Yeah.
So
I'm gonna say something. I don't know your homie, and maybe this is wrong.
Here we go.
No, I'm gonna be nice to her.
I know you are.
I think that's a little bit of bullshit.
Oh,
because I think you're deeply interpersonal since you were young, and you talked about it. You said you wanted to be with people here or there, and there wasn't people there. You said the lab was lonely and isolation. So I think that's always been a component. That other noise was getting too loud for it.
Mm-hmm.
But I think you've been very much a people person, energetic, fun. But that other shit was weighing you down, the anxiety. You talked about the homies in the crowd that you were in. So you are a people person. You might be a homebody too, but I would say you got much more love to give than what you gave yourself credit for. Just the noise got in the way of it. Now you're free. So now we get to see what you're really about. Now we get to go see how you're going to save some lives and change your life, and and change your life and finally fucking be happy.
Yeah.
So I want to push back on that, and I might be wrong, but based on what you said, as a therapist, I'm like, wait a minute, I think you love people, and you've been loved.
Like, nah, man, I've been hating motherfuckers since '94.
I know. That's why I'm powerlifting. 94. Your picture, J-Lo on
San Fran, son. San Fran.
Did I get into no, I think it was 95 or 96 when I got into my first fight. Only two fights. Only two fights in high school. I was picked on. I'm 43.
That's a lie.
She looking Asian folk, boy. I'm just gonna say
Botox.
Donate.
Botox. Oh yeah, Botox, and then I also got ultrasound therapy in Korea.
Ultrasound.
Man, they making shit. We don't
Koreans
even know.
Be making that shit. Like they got all the shit.
Yeah, Koreans. They just.
Girl, that ain't it, man. You got good genes too. You said I got bad genes. You got some good genes. After that GLP-1, the genes came out.
He looked like that when he was 17. To be fair,
me, I look like this at 17. Yeah.
It's like, damn, you got gray already, shit.
Bro. It was wild. Full beard. The running back on the team was balding, receding hairline. Yeah. Motherfucker, he had them old people veins on his arm.
Also California versus Michigan,
it's different.
It's different air.
Yeah,
it's different air.
Different air. The poverty, we drinking Flint water. Shit's different, bro.
Yeah.
Ooh.
Hey, hold up now. She good.
Well,
has a little twinge of brown in it. That doesn't make it a bad
said that's
water.
A college drink. What?
Whoa.
She didn't say that. She didn't say that. Okay. What were we just talking about, Spencer?
It went from bullying to fights to
showing up.
Yeah, you were fighting in '97. Yep. 1997. I remember Living Color was on. I was about to beat this woman's ass.
Yeah, yes.
That's right,
wow.
Jim Carrey.
Ooh.
Wayans Brothers.
I can't believe I was allowed. I can't believe I weaseled my way into being able to watch that in the 90s.
I've looked back at some of those clips and I'm like, how the fuck did this get on TV?
There you
Oh
go.
yeah. Oh
Yeah, Damon doing handyman. You don't know what that is? Look it up. It's funny.
No, don't look it up. Don't
Okay.
look it up.
It's
Look it
the
up, folks.
best. It's the
Why?
best. Handyman. I was just thinking about it.
I'm about to crop this shit and put it in here. Now that I got timestamps,
Oh man.
I
It
was
was
gonna
funny
go.
though. It's a ways, but yeah.
Mhm.
I was gonna go with her, like set it off, like bitch, you Queen Latifah now. That's where I was gonna go with that.
Living single.
Living single.
Yeah, that was Friends before the Friends. It was the
Mhm.
Black Friends, the best
Mhm.
friends.
Martin.
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 Now we're just naming black shows.
You just y'all black as hell. We black as hell today, y'all.
Yeah,
I'm gonna
that's
get my
right.
dashiki out.
California.
Let me get my dashiki, the one that the Democrats put on once a year during February.
We did it, y'all.
We
It's only the first day.
We
that they
just
do
the
it.
first day. Then
First and last. They
all
do
the
it
white-
first and last. To be
all the
fair.
white people on Instagram make their profile like black photos or whatever, right? Yeah,
Hey guys, we stand with you, but don't come into our stores.
we
Like,
did it.
what? What'd you say?
We did it. We solved racism. We did it. Okay,
How did
this
this turn
pivoted.
in this?
This pivoted. How we start shitting on white America.
It's always the Wayne brothers that turn into it. So all right. So we talked about like when somebody like takes a step back, especially when we talk about dieting. But what
Yeah.
about injuries, right? Like because
Ooh.
when you're working with athletes, you get a lot of injuries, or just people in general. But
Mhm.
then it's not just like a mentality, but you also your body is not working with you anymore,
Yeah.
right?
Yeah.
So how do you help somebody like kind of step by step kind of run through like their like recovery when it comes to not only doing a diet but also recovering like that injury that those athletes have or just people in general have?
Yeah. I think it's really important to make sure that they're still doing something and making sure that it's important, because the biggest thing is that that sense of identity is oftentimes lost with the injury. Now I can't fully participate. No, but we can do all these other things. And I think remaining positive and always reframing things as this is the thing that you can do. Here are the things that you can do. As we're rehabbing this, we can build up other parts of your body. Like, you have an ACL, you're recovering from ACL surgery. That is going to take a while, but you know what? You have another leg that's not broken, and you have your upper body that's still intact. We can get really creative with stuff. And so it's making sure that like they don't fall off the wagon completely, because, it's very easy to feel lonely and isolated, during that whole rehab process. So I always want to make sure that they are doing something, as far as not just the rehab, but also finding ways to improve other areas of what it is that they need depending on their sport, and then really making sure to check in on them, and just talking to them, because the practices are out, so sometimes they're just going to have to attend practice and still be included in the team. So I think that's also important. I think most teams do a really good job of making sure that that athlete isn't completely isolated once they're injured.
Hell yeah. Very much online with like mental health therapy. The isolation gets you.
Oh yeah. The thoughts just start, like, you can really get into your own head when you aren't, around people. And I think also with working remotely, like it also noticed that like really making an effort to check in on people, making sure to have, whether it's Zoom or FaceTime or phone call, like just getting I would prefer like something where FaceTime or Zoom where you can actually see the person's face, see their, facial expressions.
Yep. Yeah. I was just thinking about Tyrese Halliburton that just tore his Achilles in the championships, right? So they could have won. You never know.
Yeah.
Right? He's playing, you never know. They put up a hell of a fight, and then he tears his Achilles, and he talks about the anxiety and the depression after that, right? The letdown after that, the letting his team down, the city down, the state down, all these underdogs that hated Oklahoma City, right? Because they're so fucking good. And it's just very, very common when you get those injuries, the isolation just letting people down.
Yeah.
And I know people will start eating and they start gaining weight in those moments. I'm gonna pivot back to you for a personal question.
Yeah.
When you're taking the GLP-1s and you're getting like thinner and thinner, can you tell when you're confident? Spencer asked this, and some of the other pods, like, was it like a switch that flipped, or is it just little by little your confidence is growing, your swag is going, we're starting to feel like more us, more congruent? Or no, it would progress. Was it a flip? Was it one day you're still not even there and you're still like, I'm hot dog trash? Like, what's the vibe?
I don't really think I can't for myself. It's just been a gradual process. And for people that just stacking these little wins here and there and just making sure that like I know I'm capable of doing these things both, at the gym or, with relationships, just very small things over time, a long period of time. I just had a conversation not that long ago with a patient, and we were just talking about boundaries and getting the strength to have difficult conversations with family members. And it just, just asking her if like, has the lifting, like the behave, like all the habit stuff we've been working on helping. And she was just like, yeah, all of it has sort of added up because I started to take a look at like how, like I started to go to the gym, I started to cook for myself, I really started to feel good and really starting to think about like what's around me, how am I showing up in the world and how am I reacting to this, the world that I'm in, and do I like it? Is it aligning with who I am becoming? So I think that's also another important thing is like that identity shift. And I don't think there's a real switch for it. I can't think of an example off the top of my head where somebody was just like, oh, yep, I achieved this. I am good. Like lost the 20 pounds I needed to, like, we're all good. See ya. Have a nice day. Like, I'm going to flip and do all these things. It's really over time.
Over time. What me and a lot of the folks say, or right, they say when you're fat, right? I ain't fat phobic about them. I usually work. So when you're fat, you end up being super nice or like the funny one, right? Maybe you said you were the smart one, but a lot of us fell into the funny one, the fat friend, the comforting friend, the counseling friend, right? We fall into those weird, not major, not the story isn't based on us, based on others.
Yeah.
And so sometimes, right, we'll be like, man, they'll lose the weight. And then they're still nice as shit, but now they lose the weight and now they little baddies. Well, it doesn't matter what gender, they little baddies now. And they still stay like really nice and really kind. And it's like the coolest thing because you see like that pretty privilege can make people somewhat assholes, right? They may not understand the pain and the trauma of being big and being kind, being empathetic, listening to people. They don't have those skills.
Yeah.
When you see clients lose weight, do you see them stay true to their identity, or do you see them kind of assimilate into like more that pretty privileged passing culture, or do they always identify with being a bigger person?
It's not always it's not always cut and dry, but I
Sure.
do have those conversations with people where it is, you start, and ask those questions like, how is it interacting with the world? And not everybody's experience is the same. And yeah, sometimes I do often wonder, is it because I'm happier? Like I give off like this energy that I am, more confident, or really is it because of, whatever it is, this like, kind of skin meat suit that I've got going, like, the makeup, hair did, fake hair did, kind of.
Stop saying these things. You know what? I'm trash. I'm like,
I ain't real, y'all.
the dog don't even want to stay up for this.
I know. Turned his head away.
Yeah, is it the looks thing, or is it the way I'm, presenting myself,
Presenting.
or confidence, or because, I remember at that size, like yes, I was nice, but I also was really timid and shy and just had a different vibe going on. So, some combination of both. And I think acknowledging that and asking those questions. But I feel like it's not, I don't ever see them going into like mean girls mode where it's
Yeah.
like, I'm better than you. It's
Okay.
just,
I think so.
I think a lot of times it's like their kind of identity kind of trails along, like it lags behind what, the outer transformation. They're like, why is this person talking to me? Like, why is this person at the gym all of a sudden, like, like offering help, like seeing if they want to, like, like
It's
a
weird getting
guy.
hit
Yeah,
on.
getting
I
like, I
know.
got hit on, like, oh, this person was asking for my number and it was like weird. And so you talk about it and yeah, you're just like, I don't understand this attention that I'm getting from people. And it's a different type of attention. But I think for the most part, they've been still true to themselves, but still figuring out, like, who am I? Like, because it is different. It's a different dynamic that you haven't experienced before.
Girl, you're not going to talk about this because this would be too personal, but when they get their bodies and they've lost weight or something's happened, surgery, blah, 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 this new body spence that they get, it's interesting when they go for the first couple of test drives with like dates. Let's put it like that. So like go having sex, talking to people, right? It's just interesting what happens, things that happen, right? I'm just letting you know.
Yeah.
And so it's a whole new emotional thing. And sometimes it's still traumatic because they still feel big.
Yeah.
So it's a nuanced thing. But I'm telling you, man, it's just crazy thing.
I'm not saying. I'm just saying the way you said it just came off like, why are you dancing around?
I'm dancing around it.
Yeah.
I
Like,
also
just
heard,
say it. Like, yeah, you look hot, and now guys
are going to be, or girls are going to, people are going to be interested in
on you. Yeah,
intercourse.
Intercourse.
All right, I'm gonna just say, whoa. I'm saying.
There's a thing.
You're like, oh, now you a car. Like, what?
Now you're a car. They take
a new car smell? What the fuck are you talking about?
Car smell.
The fuck?
It smells like coochie.
What are you saying? You brought up cars. You brought up, like,
I don't know, man. I'm autistic.
Going to eat and then sex. Like, Hey.
Yeah.
It's different testing out the new body, man. It can be very traumatic, very anxiety provoking.
Yeah. Look, I'm a big boy myself. All right. I don't want anybody to have any illusions. I'm 300 pounds, 6'3". I'm a big boy. So it's not, I'm not sitting here being like, oh, yes, I'm been skinny all my life. Like,
yeah.
Like, I got them thick thighs. Let me tell you.
Yeah. Right? He doesn't look
I ain't going to prison. I can't.
Oh,
I've had this conversation many a times. Not going there. Because my funniness ain't gonna get me past whatever the hell's in there. All right. So I know where I stand.
I know where I stand. I heard that there's the rumor. It's not a rumor, it's just science. The dude lose weight, and then they said for every like umpteen pounds, your dun gets bigger.
Oh, like, because and I have not read that study. I saw that being passed around on social media.
I saw it on social media. I was like, look at that.
That's all I need to see. Here we go.
I'm gonna give my dad some grandbabies. That poor autistic girl. Yeah. It's a thing, man, because I got kids that after they lose the weight.
Yeah.
And now they got a partner, but then there's that fear that they're always going to get fat again. Mm-hmm. And then their partner is going to leave them and that they're going to be too ugly and too fat. So that's always a major trigger. And then the next thing is do they only like me because I'm thin? And if I was, so it's complicated when they lose the weight because the identity's still stuck in the past. Like you said, it lags.
Right.
Especially when they get off the GLP-1s, because not everyone stays on them forever. I've had some clients get off and they've maintained their weight.
Good. Yeah.
They've maintained the weight, and then I got some that do gain it back. Right. It is. So I'm gonna ask like one more question, Spence. And then we can pivot to the show. But this has been a great talk for like a lot of folks and myself. Do your athletes, because you work with a lot of folks there. Do you see with a lot of the women the eating disorders is the media reports that you talked about some of the women in sports that you work with? Me working with a lot of women athletes, right? You've seen a lot more eating related issues from on my side. I'm not sure if you see that too as a medical doctor.
Thankfully, no. And I think the sport dietitians, the high performance teams are actually really good about being intentional about emphasizing nutrition as fuel. And I think there also is a shift in kind of celebrating strength and how important strength is for overall sport development. The amount of chronic injuries that I have seen from overtraining just their sport and not incorporating some sort of strength training program, is like that makes my heart hurt. But thankfully I have not seen a whole ton of eating disorder stuff, because I think it has shifted into making sure that we are fueled, we are strong, and we are capable of like getting out there and just doing the damn thing, right? Like excelling.
There you go. I'm cool.
All right. Yeah. Before we get into it,
Yeah.
what's some music that you like listening to when you're, pumping the iron?
Yeah, because you're a gym girly now. So like it's always been one. Little gym baddie now.
Yeah.
What's the music you listening to? I'm sorry, Spence.
I think it varies. It really does vary. I mean,
it's old school, isn't it?
When 90s hip hop.
Yeah.
I mean, no, I was actually about to say if we're like getting into it, like last week I was listening to yacht rock, like Christopher Cross.
Oh yeah, Christopher Cross is great. I love Christopher Cross. Sailing. I don't know why you would lift to sailing, but you did.
Just random stuff. Let's see what I was actually on a 90s rock kick. So I was listening to Hole, I was listening to Nirvana, Soundgarden, Pearl Jam, but like when seventh grade rolled around, I think that's when I discovered my friend's next door neighbor had MTV, and so we were just watching that all the time. Prior to that, it was hip hop.
Okay.
Because
watching MTV when they have music videos.
When they had, because they had the top 10 count.
They don't do that shit no more.
It actually closed. It actually didn't it shut down in time? I was like, oh gosh, I'm old.
Yeah. My neighbor had MTV rolling.
She said all them black TV shows, and she's like, yacht rock. Threw me off with that.
I listened to Take On Me by
that's what I've been some kind
part of me thought she was gonna say Salinas. Like part of me prayed that she was gonna say Salinas. I'm like, damn girl, I see you. She said J-Lo. I thought she had a crush, Salinas. If she would have said it in that accent, I would have died.
Nah. A little Tupac, a little Eazy-E,
All right, we're going West Coast. Gotta stay the West Coast.
You ever listen to Creed?
Is that
that's
can
a no.
you take me higher?
No. Yeah, that's a take me higher.
Yeah, not really.
Oh, fuck you, man.
He said, fuck that shit.
Sorry.
What are them? Oh my god, it was like the 5 dudes. Bone Thugs. You ever listen to Bone Thugs and Harmony?
Oh, come on, first of the month. Come on.
They got some newer albums that are actually pretty good.
Oh, snap.
It's the same like tones. It's like 7 dudes on one track. It's intense.
Jeez.
They're so fucking fast. You don't know what's going on. You're like,
I'm very glad for the old school rappers. They're coming back in a good way. Like Nas, he has a couple albums that have been out. Oh my gosh, I'm forgetting his name. But anyways, old school rappers. They're on a comeback. I love to see it.
We need
all right, so we are now going to be talking about Pulp Fiction.
Oh, yes.
Yes.
I
know, right? All the movies, right? All the movies.
Old school.
Yeah. You want to talk about old school? Yeah, this movie's something. Let me tell you. Look, I'm a big Tarantino fan. Big, huge fan. This is my favorite movie. My favorite movie is probably Hateful Eight with Samuel L. Jackson and Walton Goggins. That's a great film. But this one's all-time classic.
Spencer, can you give me some help? What is this movie even about? I forgot. It's been so long since I was a kid.
It's one of those movies that it's like it doesn't really. It's all over the place, really.
Yeah.
So you have Marcellus Wallace, who's this pretty much like the kingpin of it all. And then you have the stories of like Samuel Jackson, oh my gosh, not Jack Nicholson. Oh my gosh,
Samuel
John
Jackson.
Travolta.
Oh, John Travolta.
And John Travolta, you have their story, then you have Bruce Willis's story, and then it's like, so it's not all in a straight line. It all kind of is all over the place, but then at the end, it kind of all comes together, and you can see like the subtleties in the different scenes and tell where you are if you watch it like multiple times, like I have, or anytime. But like this movie overall, at least this scene. So Marcellus Wallace asked John Travolta's character to bring his wife just to go out because he's out of town. So he asks John Travolta to just take her out and make sure she's chilling, not doing anything crazy, not just sniffing cocaine in the bathroom. Oops, she already did that. Or just dance and winning a dance competition in this like 50s restaurant, right? And so they go to this, and first of all, John Travolta's character is high off heroin. Like, he's just, because he's nervous, right? He's nervous about this because he heard a story about her that her husband threw a guy out of a window for giving her a foot massage, right?
Oh yeah, I forgot about that.
Yeah,
one does.
Yeah,
he ain't touching my girl's face.
And he was Samoan, so you better watch out now.
There you go.
Don't do any
those big boys like feet now.
You know it.
Like
and
little
ukuleles. But like. But like, and then he takes her out, but he's nervous about it because he doesn't want to, make the boss mad, and then B, he doesn't know how she's gonna act in the whole thing. Like, she could just be like a total asshole.
Yeah.
But there's a scene that we looked at, and where she talks about how silence is, she just hates awkward silences, right? But she also says that, in that, like, sometimes just, it's way better, and you're comfortable with somebody when you have that silence, and you don't have to just throw out your fucking blah 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 just for the hell of it, right? Which is, I find that true. To kind of revel in the silence. But what made you want to pick this movie of all movies, right? Of all the movies, and what made you want to pick this scene?
I think it's one of the few scenes that I actually could remember. Like, it had that much of an effect on me at 12 that I am still thinking about and like pondering over it to this day at the age of 43. And so just thinking about who I am and how, like, the food noise, and for me, just how comfortable the silence can be, and how for so long I haven't had that with food, that now that it's finally here, that I actually have space to think and to think about who I am and how I want to show up in this world, and how I want to be present in relationships. And I've always been that person who has felt comfortable in the silence. And I've taken some detours here and there. Not everybody's going to be comfortable with that. Some people find it to be completely terrifying. And so, and that's okay. Everybody's different. But for me, it's where I truly can find peace.
When you were younger, though, what did this scene mean to you?
It actually meant like finding somebody that I could share a comfortable silence with. I was actually just thinking about it the other day. I remember going out with a guy in high school. He picked me up in his car. We were driving around San Francisco. We went record shopping. Records for you old people. Like, what's a record?
No, those are coming back now. It's like a fad now. My clients do that for fun. Yeah.
I got records. I can't lie.
Yeah.
And I remember, I don't even remember what his name was, but I do remember he was like, you don't talk much. You're really quiet. And I was like, oh, is that a bad thing? Because I was just enjoying the record shopping. I was just kind of doing stuff. And I guess I just didn't ask him a whole ton of questions. I think I got to know, I don't know. I don't even remember talking to him. I remember having a really good time.
She was at the record store.
It was like the records. You care that he was there.
Just women just having fun on dates. Don't even care about the dudes. They're just getting
What'd you say? Oh, shit. Yeah.
I just need to ride to the record store. That's all.
Yeah.
Jesus. Girl, you've been a killer since day one.
I don't even know that motherfucker's name, what he said.
He's a heartbreaker.
Nothing. He had a car. That's all
He did have a car. He did have a car.
Do you remember the car?
Ooh.
I want to say it was an like a
of course it was an Acura.
240, like a
Acura
240.
girl, look at you.
I remember it was a manual transmission. I remember it was low to the ground.
Spoiler.
Yeah.
Oh God, damn it!
The men you were choosing were trash.
Oh my God, just
It was high school, for crying out loud.
It's
what does that mean?
I mean, she was still smoking a pack a day. It was intense.
Marlboro Reds, not a pack a day, but
I know,
Marlboro
I
Reds.
know.
Hey,
Oh
when
God.
Fast and the Furious came out, you're like, this is my shit. Like, I don't.
That was the shit.
Yeah.
Tokyo Drift is
I didn't want to say it, but you said it. Yeah.
of all the Fast and Furious movies, the Tokyo Drift holds a special place in my heart for whatever
Can you
reason.
explain why?
Yeah.
I think it was just at a time where I was also kind of into cars. I had a 2006 STI. I was sort of like, I was tracking it. I was autocrossing it. And I remember watching that movie, and I just thought it was fun. I thought it was a totally fun movie compared to some of the other ones that were out there, because it was just, for whatever reason, it stuck with me.
That's fair. Damn.
I didn't mind it.
Shoot.
I liked it.
I feel like if you're from California, you kind of have to like cars in a way. You know, like my grandpa, he used to race Ford Mustangs, and they would have all these different cars. They had this one car my mom talked about of how it was like this low to the ground like pickup truck, and that shit was boost, like it would zoom. And my grandma would drive the car and just and then just go right down.
Like drag racing.
No, my grandma would. My grandpa would drag race. Yes,
okay.
on a track.
Yeah.
Not in the street.
Yeah.
No, but you get that affinity to cars, especially because not only are they something to where you can show off your personality through it, but it's also like your culture and stuff like that. Especially like the Chicanos, like they always be driving those lowriders and shit. But that's part of like the culture. And what it is. Did you feel like that with like your car and shit? Like, was it did you feel like it was an external part of you, like you could put out to like and let other people see if you're not like totally verbal?
It wasn't like the look of the car. It was going up and showing up to the track, because for myself, it was the driver was the most important modification. And so going to it, like seeing how fast you could drive your car compared to other people, or going on the track and having somebody else get the blue flag with the yellow diagonal to signaling them to get out of your way. But you also have to be controlled about it. You can't be like, you're not in the street, you're in a controlled environment, and you have to play by the rules, right? You can't be a total dick on the track, right? So you can't just it's not bumper cars.
For someone that doesn't like talk much, or you didn't talk much, you've got a lot of stories. And I just like every time, like the awesome one when we got the interview the other day, at coaching her, I'm just like, we just got so much, like we could spend like 10 hours. I feel like there's so many stories that are in the nooks and crannies of her brain.
Did you race for pink slips? Did you?
No. Kept everything kosher and on a
everything on the legal side. I swear.
They
maybe had the police radios just checking to see where they were. That's about it.
No, because oh my gosh, especially when I moved to Chicago, the cops would just follow me, like, because I would be in the right lane, because I would take the car to the track. I would get, like my racing kicks all out, honky dory. And so when I drive on the streets, it's like 65 miles an hour in the right lane, like this. And then the high beams, they just flash the high beams and just trail you, for God. And I'm just like, hey guys, hey y'all, I'm not doing anything. You can follow me if you want. Like, we can ride together.
Welcome to being black and brown in America, girl. Yeah, here's your first experience.
Pulled you over. He's like, is that a yellow page under you?
A yellow page because she's so short.
I did. I actually had to
12-wheeler?
have. They pulled when I went to Bondurant Racing School in Arizona, and they put us in. Oh gosh, it was like a C6. It was like, and they're big. You know, they're made for like American-sized males, and so they had to take one of the go-kart like seats and like put it in there so I could just kind of see over.
Girl, life's fantastic. You've got so much more life to live, my guy. If she's saying she doesn't know who she really is and she's about to walk into it, I'm like, girl, I feel like you lived a couple lives.
Yeah.
Just sit at home with the dog. Just cook and read a book. God damn
Was it
it.
fucking Suki and Too Fast, Too Furious? Are you Suki? They
Is it
base that off
Suki?
you? They base Suki off you? What the fuck? Had your
Might be-
pink car?
She might have a Gal Gadot phase in there too. Who knows?
Yeah.
But yeah, man, she probably has some interesting. I would love to be her therapist right now. I'm telling you, I'd be getting into. I'd just be pushing her to do stuff like Hannibal Lecter, like you can do it.
Keep drag racing, but this time on the street.
Murder them.
That's right. Hey, you have some fun in Philly. They like to,
I
do
know.
a little racing. Race.
Oh, you might need to get you a dirt bike.
Or
no.
a four-wheeler.
Girl,
Get a
you
four-wheeler.
got it.
Just-
Don't
Now-
knock it. People
Oh,
in Philly
no.
gonna watch this. Don't talk shit now.
No, I'm not talking shit. Because
I'm joking.
they had four-wheelers. They were four-wheeling
Yeah.
out on the snow. Yeah, I think about how much that's going to cost. And I only have one parking spot. I only got one parking. I'm in
Girl,
the city. I'm in the city.
girl.
Oh, okay.
You know how to hustle people, man. You hustle you up a guy, and then you get you be his little sugar baby. It'll be all right.
Oh my god! Why?
Hey, my clients be like, I'm gonna quit school. I said, you can be a sugar baby. You got. She's like, I can't do that. I'm like, all right, so take your ass back to class.
Oh,
I'm not the best therapist. I'm really not. Girl, I gotta share
He
this
said-
story. And I'm
Yeah.
done after this. One kid, we're talking about, menstrual cycles. We're talking about
Yeah.
birth control. They're
Yeah.
talking about spotting and all this shit. And I'm like, because we were talking to the coach last week, and she said there's a reason why these young girl athletes, they need to stop wearing like the white pants and all that stuff to make sure that they can perform, and they're not worried about this, and they're not worried about their bodies, and how do we make it affirming for women? And she's like, yeah, I'm just making sure, because the spotting is increasing. I'm making sure that her clothing is correct. That way she doesn't embarrass herself. I don't want her to be agoraphobic to go outside. She's like, nope, I got the blacks, and I have black, draws, and the blacks. Shut up. I got the black draws.
see the
And
twinge from both of us. Just like what?
they
What
both
was
went,
that?
what?
Huh?
And I said, girl, because I said, good thing about black underwear, and I go like this. And she goes, why they that big? I said, they hide the shit stains too. And she goes, what the fuck?
It's fucking sumo wrestler over there.
And she goes, no, I was like, your draw's this big? And I said, oh no, man, it might be.
Why are your jaws bigger than you?
It's like a diaper. You got to take the motherfuckers in.
Oh, okay. My bad.
You got to tuck a roll.
Gotta tighten it up. Yeah,
Yeah.
tighten it up.
Yeah.
Has elastic already, but you're just like, I gotta tighten it up still.
The fact that this is the same girl that roasted me for being gay for putting on chapstick, that
I
made
mean-
fun of me about my draw presentation. Wild. Wild. My
That's
clients
fun.
are fucking horrible to me. Horrible.
Deserved.
All right. Last thing.
Yeah.
You talked about helping your, I swear to God, this is funny. You talked about helping your clients set boundaries.
You're a liar.
I know. This is shit
Yeah.
is funny. She's like,
Yeah.
I'm helping people set boundaries. You're setting boundaries. My client sends me a text like 4 hours later. She's like, hey, I don't want to do this thing. Blah, blah, blah. I'm like, fuck, stop. Don't set boundaries with me. Set boundaries with your friends, you son of a bitch. Stop practicing the stuff with me. Like I'm actually proud of most of my clients when they set boundaries with me on certain things or topics or the exposure therapy that they don't want to do out in the real world. And I'm also like, fuck you, man. Just I taught you too good.
Jesus.
Ah,
All right.
done.
Well, with that,
I'm done. This is great.
this is great. Man, Pulp Fiction.
Yeah.
Nah, man, I'm pretty fucking far from okay. If you know the scene, you know the scene.
Okay.
Bring out the gimp. I didn't make that up. I'm
No,
quoting.
I
I'm
know you
quoting.
are.
I know you know. The fact that you saw that at 12 is fucking terrifying
Wow.
and hilarious to me.
At the very least, I did. At least I didn't bring up the other movie I saw when I was 12 was Kids.
Oh, that fucking crazy ass movie. Yeah, no, that fucking.
She said that earlier. I just smiled because I didn't know what she was talking about. I was like, oh yeah, kids.
Do you want to? Because I
Karate
remember the
Kid?
plot of that. I remember
Karate
the plot
Kid.
of that movie.
Hey,
Do you want? So TLDR. So basically,
TLDR. You're not 12.
it's just 24 hours in like a summer, in New York. And the scene starts off with basically there's a guy, a skater boy named Telly, who has HIV. He has given HIV to one girl, and she spends the entire time like chasing to find him to go let him know that she's been diagnosed with HIV and it's from him because she was a virgin. And like there's party scenes, there's like drugs involved, like there's a fight scene, a pretty nasty fight scene with the skater guys with one guy, and then it ends with a pretty disturbing assault scene at the very end. Yeah, it's a very disturbing film.
Okay.
Yeah.
This makes
like
sense
Kids in the
why you're
90s.
like this. I think the unfiltered access to TV shows, I wonder why she was quiet. Bitch was traumatized.
You know what happened? It was MTV. That fucking
Yeah,
it
yeah.
was MTV. It
Marilyn
ruined
Manson. Yep.
It does. It's the gateway.
The NSYNC, Backstreet Boys, it got you.
Oh
Yeah.
my gosh.
Yeah,
It wasn't
Britney.
at all the fucking Pulp Fiction or the fucking yes, it did it.
Yep.
Wasn't that? Nah.
No.
Oh,
The
okay.
Tetris
Well,
that came out.
Dr. Christle.
Yes. Oh.
Hey, thanks for coming on. We appreciate it. If you want to do your plugs, you can. Also, hey, had a great conversation. Love to have you back. Forgot to mention that with Alicia. I should have, but I didn't. Because we were just rolling with the conversation, and I forgot to ask. But yeah, would love to have you out again. Whatever movie, show, probably not Kids.
I definitely would not pick. No,
Okay.
I would pick something a lot more mild than and even with this scene,
Yeah,
it's just that one line. But yes, I will pick something a lot more mild.
Nah, man, I'm pretty fucking far from okay. Just putting that out there.
Okay.
All right, plugs, please.
You got any plugs? What are you doing? What are you up to? How can people find you? Blah blah blah.
Right now, I'm on just on Instagram, Dr.Christle, Christle. I have a free beginner's guide to GLP-1s. It just talks about nutrition, talks about training, but it also gives little snippets of like parts of my journey with every kind of step. And it's it's 130 pages of text, of pictures. Like it's not all heavy text. It's like, broken up into colorful graphics and stuff like that. So it's free to download and it's on my bio page.
Girl, what you trying to say? You like, motherfucker, I know you can't read now. They got the pictures for you, you dumbass.
I actually couldn't read a ebook PDF document that's 130 pages of text. I wouldn't want to read that. Okay. That's why I like the colors.
Okay.
So
I thought you were trying to go trauma for trauma with me. Like, I can't read either now, so I'm illiterate. Like, bitch, you're a doctor.
No.
I got you. Okay.
Yeah, all good. So
and you're not accepting any clients right now, you said?
Currently, no. I have a couple of other things in the works.
Okay.
Yeah, but it'll hopefully the next time I come back, I'll be able to talk about it.
Okay, here we go.
I am. The other thing, I am helping out with a kids activity book. It's local to Northeast Pennsylvania, and I can provide the link for that if people are interested. So, yeah.
I'm gonna try and set you up with this person named Mark Lamont Hill. You heard of him?
Who? I'm sorry.
Lamont Hill.
The name sounds sort of familiar.
The Philly guy. He was in politics. He's a teacher over there. Was doing some stuff with the UN. Was on BET and the news channels. He got a bunch of stuff. Like, he's extremely influential. Fantastic dude. Does speeches with a lot of black folks and talks about a lot of awesome things. Even all the way to like Palestine and black folks in Palestine. Fantastic. But he's got a couple bookstores there.
Ooh.
I'm gonna try and make sure maybe you go hook up with them for any kid related stuff too.
Yeah, would love to do that.
Yep.
Yeah.
Uncle Bobby's.
Cool.
All right. Sorry, I just wanted to plug that, and I'll let you know later about that.
For sure. For sure. Thank you so much for having me on.
Yeah.
Yeah.
Thanks for coming on. With that, I'm Spencer. That's not Different Spectrum Podcast.
All right, everyone. Much love. And remember, take care of yourselves.
Or don't.
That's completely up to you. Peace.
Yeah.
There it is. Let me hit fucking stop record.